Hi everyone, so I just wanted to go over, I'm doing my exam reviews for my boards for psych mental health. Some of the more complicated, I guess, memorization techniques that it's hard to categorize when you're thinking about it in testing is some of the test questions that I've seen for our practice exams are, if you, let's say a patient struggles more with depression and they have a hard time getting out of bed, right? What type of antidepressant would you be prescribing? Now that's really hard because, I mean, what's what? We know in your, at this point in time, you should have an idea. Actually, you shouldn't have an idea. You should know which are your SSRIs versus your SNRIs and also your NDRI, right? So this video is not about memorizing that, but memorizing the category as to what is more activating and what can help a patient, get motivated in the morning. And then if you have a client who has a hard time falling asleep, what can be an antidepressant that might help them fall asleep? And this is something that we should think about because we don't want to give a patient an activating medicine and give them energy when they already have anxiety as well, which is very comorbid with depression, right? So this is not specifically SSRI versus SNRIs, but this is how to differentiate or what modalities to choose to give to a patient. Okay, no more ranting. So this is one of the ways that I was able to memorize it. So activating, we've got WEP. Kind of sounds like I don't know, WAP, WEP. Let's go, right? Activating. So we've got here Wellbutrin, Effexor, and Prozac. Wellbutrin, you guys know, is an NDRI, Wellbutrin, right? Wellbutrin, whatever. Effexor is an SNRI, right? Prozac is an SSRI. Another way that you can really dig this in and drill it into your memory is WEP, okay? Wellbutrin, let's get well. Effexor, let's get the effects of the drug. Let's go. Let's do some effects into our day. Let's get activated. Prozac, this is a good one. Prozac, let's become a pro. Let's get activated. Let's be pro day, I guess. Pro for the day. Let's get activated. So those are the activating drugs that I would use. All right. Now we're on to our less activating medications, right? So hopefully, I think I might have blocked that, but I'll probably redo that video earlier. Less activating, okay? We've got, my acronym that I came up with is PACED, P-A-C-E-D. PACED would be your Paxil. All right, this one, if you can guess, it's a tricyclic antidepressant. It would be amitriptyline. Okay, I'll just put here. Amitriptyline. C, what is that? Oh gosh, it's Celexa. Okay, so this is activating. We're pacing ourselves. We're not activating, we're not giving energy, we're pacing and getting rid of the depressive symptoms in the pace level, right? So now where are we at? So now we've got our Celexa. I forgot what the E is, but definitely this one is doxepin. Okay, we also use it off-label in sleep, and it works better when it's in the low doses for sleep, right? For antidepressant effects, we want to do a higher dose. I'm not going to go into dosing. You guys can go and look at that yourself. But all right, can anybody guess what the E is? I had a hard time, but here it is. It's escitalopram, right? Escitalopram is an SSRI. All right, so let me just redo that again. I like these little notepads, so don't, everybody works in different ways. All right, what's the acronym again for less activating? We've got to pace ourselves, or we have to get paced. Nice rhythm, not activating. Paced. What does paced stand for? We have our less activating. We've got our, what is P again? What's P again? It's Paxil. All right. P. Paxil. A is a tricyclic amitriptyline. Okay? I forget how to spell it. C is Celexa. Interesting thing, I would read up about it with Celexa and cognitive issues for elderly people. So check it out. Escitalopram is an SSRI. So we've got Paxil, SSRI, we've got tricyclic antidepressants, amitriptyline, Celexa, escitalopram, and what's this one? It is doxepin. Doxepin, I mean, how would I remember that? I would just probably put it in the paste section. It's an odd medicine. Do I use it a lot? No, I don't use it a lot. Doxepin, lower doses, don't forget, is more sedating. All right. So, in general, what is a good acronym for antidepressants in general? The most used for anxiety, because we use antidepressants for anxiety, right? It takes about 5 to 7 weeks for it to work. An acronym that I would use for an antidepressant would be V-SPEC. Why SPEC? I like Dr. Amen. If you guys follow him, he used spectrometer, SPEC scans. All right, so V-SPEC. We've got our venlafaxine. All right, I'm not writing the entire thing. I don't have a lot of room. We've got sertraline. Let me put a line. Sertraline. We've got our Paxil paroxetine. Please, you have to know your generic and brand names for the medications, because they throw them both in there. Escitalopram. Now, this one is for antidepressants that you use primarily for anxiety. Okay, and then C is citalopram. I would definitely know for the boards what the difference is between citalopram and escitalopram. Okay, citalopram. All right. So what are the 3 acronyms that I've gotten to? First one that we talked about is activating ones, and they are, we're gonna pause over here. Where is my, there it is. So what is the more activating one? WAP, Wellbutrin. Effexor, right? Effexor, let's get the effects. Prozac, let's become pros in a day. Activating antidepressants. Less activating. Less activating. We have, what's the acronym? PACED. P-A-C-E-D. How do I remember that? Let's pace ourselves. Let's not get too activated. Let's, we have already maybe anxiety overlapping, maybe some PTSD. Let's pace ourselves a little bit. These are the medications you would use. Paxil for P. A is amitriptyline. C is Celexa. E is escitalopram, and then D is doxepin. All right, antidepressants used primarily for anxiety, V, spec. All right, venlafaxine, sertraline, paroxetine, escitalopram, and citalopram. All right, hopefully that helped you guys. I'll put the acronyms here. All right, new to the YouTube thing, so hopefully that worked. So this is one of the ways that I was able to memorize it. So activating, we've got WEP. Kind of sounds like I don't know, WAP, WEP, let's go, right? Activating. So we've got here Wellbutrin, Effexor, and Prozac. Wellbutrin, you guys know, is an NDRI, Wellbutrin, right? Wellbutrin, whatever. Effexor is an SNRI, right? Prozac is an SSRI. Another way that you can really dig this in and drill it into your memory is WEP, okay? Wellbutrin, let's get well. Effexor, let's get the effects of the drug. Let's go. Let's do some effects into our day. Let's get activated. Prozac, this is a good one. Prozac, let's become a pro. Let's get activated. Let's be pro day, I guess. Pro for the day. Let's get activated. So those are the activating drugs that I would use. All right.